thank you guys for having me today. I really am excited about talking to you about something that's very passionate to me. As Ashley stated, I am a long-term care pharmacist, so I, up until about a month ago, actively worked inside the nursing homes. Right now, because of COVID-19, I am doing everything remotely to support my nursing homes and my residents. But also with that, I am a fitness professional. So I have a nutrition coaching background and exercise background. And what I love with this talk today is kind of put all three of those philosophies, pharmacy, nutrition, and exercise all together and kind of give you some steps to succeed during this, I would say, difficult, sometimes a different situation. Some people, I would say I'm a closet introvert. So this has kind of been a nice, maybe for me, a break from the social norm where some people might be going kind of stir crazy and not sure what to do. Either way, all these steps will work for you and to help you get through the situation, not only help you now, but help you in the future. So that's my biggest takeaway from this is, doesn't matter what your age is, I don't want you in one of my nursing homes. Or, you know, if you're in there, it's going to be short term only for rehab and then you're out. And the more that you can follow these steps, the better you will be to not be one of my patients in my nursing home. So let's just talk about the steps for success. And it's just three, just very, it's routine, it's exercise, and it's nutrition. So routine is probably the hardest for people if you haven't already established your routine, and that doesn't mean Netflix binging the tiger show that I have yet to watch. It's setting up an actual routine. So you get up the same time that you were when you're working. You get dressed, whether it's workout clothes, comfy clothes, but you're at least getting up, getting dressed, making your bed if you do that, and then following a work pattern, a sleeping pattern. Because what happens is some people treat this as your Saturday and Sunday, and the routine goes by the wayside, and then you end up being on the couch and Netflix binge or something else, or you're like, oh my gosh, where'd the day go and I didn't do a thing. So, you know, the best thing to do is to write a schedule, have a calendar, write that schedule in as what you're going to do. Because I don't know, at the end of the day, sometimes I was like, oh man, I really want to do that, and I totally forgot about it, and I sat there on Facebook and just got upset all day. And I'm sure Dr. Wright might get into some of that on social media aspects. Write a routine, write a to-do list, and that will help you so much. And in that to-do list, we're going to talk about exercise. You want to make an appointment with yourself, whether it's now when you're socially distant, or later when you possibly can go back to the gym or meet up with friends. You want to write those appointments in, because usually people don't break appointments. And so what I don't want you to do is break an appointment with yourself. It's so important to put in that exercise, and not just for weight control. It is important for your mind, your brain, just as like to have that emotional outlet. Sometimes that exercise helps with. Sometimes exercise will also help with those endorphins, those happy little neurotransmitters that you want. So, you know, it doesn't have to be going out and running a marathon. I know a lot of people think exercise, oh, I don't like to do exercise, I don't want to do it. Pick something you like. Pick something. It might be a walk. And if it's a walk and you're like, well, I don't really like walking, well, make a playlist of your favorite music and just go out. Does it have to be power walking? No, not right away. Can it be easy walking? Sure. It can be whatever you like to do. If you like to go and hit a heavy bag, hit a heavy bag. If you like to do aerobics, do aerobics. Find something that you enjoy and you will do it. If you find something, if you say, oh, I'm just going to start doing this, or I'm going to start cycling, and you hate it, I can guarantee after the I'm going to do this wears off, you'll never go back to it. So the one exercise that you can do is the exercise that you liked to do. And then you can start building upon that afterwards. I'm a big proponent on weight training, especially for females for osteoporosis and to keep your metabolism in check. But that's something that can come later. If you're already at that point, great. If you need help, I already told Ashley, people can reach out to me and I can point them in the right direction of what to do. Then let's talk about accountability partner. You can have an accountability partner right now. I have several people. I have some friends in West Virginia and California, and we all have a chat group that we all check in with each other every day to see how many steps we got, to see how we're doing, to see how we're doing emotionally. And I'll keep doing that even after this coronavirus and we start implementing the phases. So if you have that partner that you're checking in with every day, checking in on your mental health, checking in on how you're doing, it's so much better because you got someone else checking in on you. So let's talk about nutrition. This is the big factor because I always say you can't out train a bad diet. Nutrition is 100% the end all be all. The one thing I can say is that a lot of my nursing home patients used to be higher in age. I'm seeing a lot of 40 and 50-year-olds, not just for rehab, but for long-term care. And that's because of diabetes. That's because of not taking care of themselves. So how can you start? It's baby steps. Just as exercise is baby steps, nutrition is baby steps. Get rid of the processed foods. Get rid of the sugar heavy foods. Get rid of maybe going out to McDonald's, all the fast food, which has been easier, I think, for a lot of people. I think a lot of people are also struggling with the cooking aspects that is going along with this coronavirus. But you want to go back to whole foods. You want to go back to basics. If it came from the ground, if it came from a mother, you're pretty good. If it came from a factory, if it came in a package, not so much. So what does whole nutrition do and why is it so important? Because you see low fat, you see fat free, and you're thinking, oh, well, that's cool. It's all about calories. It's not. Fat free and low fat is chemicals. You want real stuff putting in your body. When you have real stuff and you decrease your sugar consumption, you decrease inflammation. And that is huge. And that's what we're finding with COVID-19 right now, is that a lot of the complications are due to an inflammatory response. So the more that you can exercise, keep those lungs healthy, eat real foods, which will decrease inflammation. And not only when you decrease inflammation, what happens? You get more energy, you feel better, your joints don't ache as much. If you get headaches, you'll find that the headaches go away. You'll find that, yeah, the side effect is that your clothes feels better, that you feel better, that you feel a little bit leaner, maybe a little more muscular. Those are the positive side effects, but I always call out non-scale victories are more and more important. Blood pressure goes down, cholesterol goes down. If you're diabetic, your A1C goes down. So there's so many things that you can do that are in your control. Because right now, sometimes it feels like everything is spinning out of control. And the one thing that is in control is movement and what goes in your mouth. So how do you put those together? I recommend journaling. I know some people don't like that. So it's not just journaling. It's just like a notebook. You can write down what you're eating every day. There's things called like MyFitnessPal, which is a digital platform that you can write down. When you actually put down what you're eating, what you're doing, and you see it on paper, it's so much better than going, oh, I just had a handful of M&Ms, or I'm going to the kitchen because I'm bored. If you plan, you will succeed. If you don't plan, you will fail. So it's just having that mindset, changing your mindset that I got this, I can do this. I just have to make a little plan. It might be, okay, so I'm going to figure out what I'm having for breakfast, lunch, and dinner, or what I'm going to have for my snacks. I'm going to plan all this out, and I'm going to have an idea of what I'm going to eat. That does not mean you have to meal prep. I know people are like, oh my God, meal prep is just horrible. I don't meal prep. I meal plan. My husband and I don't really like to eat leftovers or something I made on Sunday the whole entire week. So I will have all my groceries. I have my list. I know what I have. I know what's in the kitchen. And then I will meal prep plan every night. I know what we're having for dinner. And a lot of times we'll have leftovers. So the easier you can make it, the better. Don't think of it as just take it down in baby steps. So maybe your first week, you go for a little bit of a walk. You have a playlist, you have some music, you go for a great walk. Maybe the second week, you go with a little more speed, or you add some weights. So every week you build upon. Now with nutrition, the same thing. The first week, maybe you just kind of decrease the amount of sugar you're eating. The next week, you add a little more vegetables and fruits. The next week, you decrease how many times that you're ordering takeout or going and when you get back to work or calling out. Maybe you're packing your food instead of calling out. Maybe when you have your coffee, you're not putting so much sugar into it. So just take it baby steps. Don't go all or nothing. No one goes and runs a marathon tomorrow. You have to train for that marathon. Same way when you change your routines, when you change what you're doing, you have to take it in baby steps. And if you take it in baby steps and you just add on something every week, you'll be successful. You will be successful. I know it. I've trained and I've coached enough people to know that when they go all out the first week, they're not going to be back the second week. But when they build upon something every single week, and Ashley has heard me talk about this in my classes, I don't know how many times, you will be successful. You just need a plan. And I will take it back to Ashley so she can take it to Dr. Wright.
All right, Dr. Wright. Amy, thank you so much for the information you just shared, Dr. Wright. Please take it over.
Well, thank you for asking me to participate today. And thanks, Amy, for a great section on regimenting your schedule and getting into exercise and eating foods that will help you with managing these crises. I might just mention something about the scheduling part, because that's extremely important. There have been a number of research studies that have shown that if you have a schedule that is fairly routine, that your hormones like your thyroid hormone, growth hormone, cortisol, and so forth become regulated. It's a way of, we call it in training, the biological rhythms in your body. And if you do that, then your physical health is better and your emotional health is better. So I can't emphasize that more. And with this COVID-19 thing upon us, most of us have had big disruptions in our schedules, and it's hard to get back into an organized way of living your life. So it's advice well worth taking. So I want to first touch on mental health in a pandemic. Even before the pandemic, we've had a major problem with mental health in the United States. Some of you may know these statistics, but they're pretty scary, actually. About 1 in 5 people experience clinical depression in their lifetimes, and the rates of anxiety are even higher. So you're putting the two of them together, about 50% of people in the United States have some form of clinical depression or anxiety, and not even half of them get treatment, and only 20% get adequate care. So we've got these huge problems in delivery even before the COVID-19 pandemic. So it's hard to tell exactly what's happened with rates of anxiety and depression since the pandemic, because you need to do epidemiological studies to really find out the answers here. But we have seen some information that suggests that the rates of these conditions are really surging. I saw an article recently that 50% of the healthcare workers in Wuhan, China, are depressed. I mean, that's a lot of people with depression. I also saw some information that people with anxiety are having a great increase in panic attacks. These are these extreme versions of anxiety in which you wonder whether you're maybe having a heart attack or you're not able to get your breath. And it might be difficult to distinguish, are you having a panic attack on the one hand, or could this be the first signs of virus infection? Here's a little tip here on how to distinguish the two. And one of them is that the viral symptoms are going to come on more slowly. You might have symptoms of cough or fever or sweating, or like my wife had, profound exhaustion, headaches, and even chest pain. But the panic attack comes on very quickly, very abruptly, and usually goes away within 20 minutes or so. So that would be one way to distinguish. But if you're concerned about whether you're actually having the COVID-19 or you might be having a real heart attack, of course, see a physician. So how can we cope with all this stress that's coming on us now? And how can we protect our mental health and maybe even improve it in the face of this pandemic? So I thought I'd touch on a few other things that Amy hasn't mentioned. I think all of her 3 suggestions are terrific ones, and I try to do them myself in my own life. but I wanted to cover three more things that I think might be valuable to turn our attention to. I want to start with social isolation and loneliness. So we know we're in an era of social distancing, which may keep going for who knows how many more months. It's the number one method for reducing the spread of COVID-19. But unfortunately, this social distancing have devastating effects on our emotional and physical health. So in a way, the cure is part of an ongoing problem. So we need to figure out what we can do with confronting and managing the problem with social distancing. There were some statistics that showed that even before the pandemic, there was a poll done by Cigna Insurance in January 2020, and it found that 3 out of 5 Americans reported that they were lonely. And I wonder if we redid the poll today, what we'd find. I'll bet it's higher than 3 out of 5. Well, what does loneliness do to people? So research has shown that inadequate social connections have been estimated to be about as bad if your health as smoking 15 cigarettes a day. Pretty amazing, isn't it? And loneliness and social disconnection can be as harmful as high blood pressure and obesity, increases your risk of an early death. And what can we do about this disconnect that's happened in the culture in the United States and around the world? I imagine that all of you have taken some steps already. One of them is this virtual Rotary meeting. So we're gathering together, and this is very good. I'll bet that you've been doing Zoom and FaceTime and Skype meetings with your family and your friends. But I thought it might be helpful to consider doing a more detailed action plan instead of a scattershot thing of picking up a Zoom meeting here and there, or making sure you're dealing with your FaceTime connections with your kids or your grandkids, but to be real thoughtful and intentional about how we're making these connections. So if you step back from this and devote a little time, maybe 15 minutes or 20 minutes or so, and looked at your social network, do an inventory of your friends and your family. Are there people out there that would be good to connect with for your own good and for their good that maybe you've missed? This happened to me. I was thinking a while back, just a few days ago, about who I'd missed, and all of a sudden it occurred to me that a cousin that I've been known for 70 some years is in a senior citizens facility in Pennsylvania. Her children live far away from her, and I hadn't really thought of her or talking with her. And when I went through this inventory, I said, gee, I should call Betsy. And so I did, and boy, was she grateful to have that connection. And it felt good for me too, to make that connection. So I'd say take an inventory of your family and friends and look at places that may be some opportunities that perhaps you've missed. Try to be creative in doing this. Maybe you should set up a weekly schedule to be sure you stay on top of this connection curve. Should you call a certain friend every week or every 3 days, or get in touch with them with FaceTime? Are there people that are elderly or sick that you could reach out to? And how can you be creative in making these connections? I thought of some examples of things that people have done for me, which I thought were really super, very creative and very helpful. Both of my sisters, who are lovely people, we're really close, but they live far away. And they knew I was having trouble getting some things like soap, some Dial soap and some things like that here in Kentucky, with the stores being picked clean. And they live in rural areas where they're able to find the things. So they both sent me care packages. And then a long-standing friend, a pediatrician who I went to medical school with, who's really immersed in the COVID-19 epidemic. He works right outside New York City in New Jersey. He's made an effort to call me every week to check on me. And I thought that was really terrific. And then just yesterday, I got a letter in the mail from a friend of mine, Paul Ayers, who some of you may know here in Louisville, who knows I'd love to go fly fishing, and I can't go fly fishing right now because I can't travel to where I usually go to do this in April. The caddis flies are hopping in Pennsylvania, but I can't go up there. But Paul was very thoughtful and pulled a couple articles out of a magazine and clipped them for me and sent them to me. So these are just some examples of some things that you might think of doing in your action plan to foster connectedness in this time of disconnectedness. There's another, moving on, I said there'd be 3 things I wanted to suggest. And the second one is to do your best to try to fight a siege mentality, I call it. There's so much negative news coming at us all the time. If you watch CNN or any TV show, or pick up the newspaper here locally, or the New York Times, the Wall Street Journal, any of these are going to be loaded with bad news. And we see our friends fall sick to the illness. We see people getting severely ill and some even dying. So it's natural to be preoccupied with worry and concern, maybe even sometimes despair at the situation around us. And if we carry these burdens with us all day long, even if they're sort of in the background while you're maybe distracted by something else like a TV program or reading or something, carrying these things around can really take a toll on your emotional and physical health. So I'm thinking of some things that we might do that could help us somehow get through this onslaught of bad news and focus on some things that maybe we miss in the heat of the moment. So I was thinking of a strategy that was suggested by a friend of mine, Giovanni Fava, who lives in Bologna, Italy, and has been right in the middle of the worst of the epidemic there in Italy. Giovanni's a psychiatrist and writer. He's an editor of a journal. And several years ago, Giovanni founded a form of therapy called well-being therapy, which I've really taken to. I've studied with him and tried to learn how to do this form of therapy, somewhat different than the traditional therapies that we do. It doesn't require medication. It's not psychoanalysis. It's pretty straightforward. But Giovanni found a thing in one of his journals about a contribution from Seneca, the Roman philosopher, way back about 2,000 years ago. And it turned out, they had some tough times back then too, but Seneca suggested that people keep what he called a well-being diary or a log, so that they would pay attention to things that happened in their day that they may have missed otherwise, just to write them down and to think about them a little bit and try to hold on to them. And Giovanni used that as the core of his development of this technique called well-being therapy. So what you do in well-being therapy is, in the beginning, you just have a diary and you write down events in your lives and then what feelings of well-being they seem to trigger. And then ultimately you write down things that seem to interfere with your sticking with that or staying with that sense of well-being. Maybe it's being really busy, or you've got a big to-do list, or you have lots of things interfere with your staying with these senses of well-being. But what you can do is you can cultivate attending to these feelings of well-being and trying to savor them. In a way, it's a bit like mindfulness. Some of you may have heard of that or even use that in your own lives. In mindfulness, you're trying to be more aware of things. And by doing that, you seem to be settled. It calms you, maybe makes you feel better, gives you a sense of contentment or so forth. But in this particular technique with a well-being diary, you can write some things down and take a little time every day to look at them and see what you can do to try to hang on to those things. I thought of an example just from yesterday. I took the day off, and it was a beautiful day, and I was working in my garden. Some of you who may know me know that I have a pretty big garden. I've been into perennial gardening for 3 decades or so. And this time of year is a really busy time of year in the garden. So I was laboring away, transplanting a bunch of things, transplanting some daisies and some other plants. And it occurred to me, was I just being driven and trying to get this job done? Was this a chore, or was there pleasure in this that I was missing? And in fact, I sort of caught myself and I thought, well, doctor, take your own advice. So I stopped. I have a little garden bench. I sat down and thought about some of the things I've been doing in the day. Then I walked over to some tree peonies that were just starting to show their big buds. And one of them had just the beginnings of the pinkness that's going to explode into this glorious, big, almost dish plate sized bloom. And I just looked at that and just had the feeling of contentment and joy in seeing this really miracle of nature. It was in a way sort of a magic moment. And of course, I went back to get some of my transplanting done, but I tried to hang on to that experience and image it and stay with it. So this is an idea that you might try out, is to make a well-being diary and see if you can cultivate that part of your thinking. So the last thing I wanted to chat on today was, if you have a mental health issue, if you have depression or anxiety, something that's really troubling and you think you need help, don't let the COVID-19 pandemic get in your way, because mental health delivery has been transformed. It's been transformed almost overnight. So we're doing our work now almost completely by remote delivery. So if you would take me back to the very first week of March, I would have been in my clinic at the University of Louisville, and patients would be coming into the waiting room. There'd be, because there are other doctors there, perhaps 25 or 30 people tightly crammed into the waiting room. I'd go back and I'd take the patient to the waiting room, take them to my office, walk right side by side with them, sit down in the office, and we'd have our session. And that was all well and good, but of course we can't do that any longer. So we've moved to telemedicine and even old-fashioned technology like using phone calls if people can't hook up to something like we call it Blue Jeans. It's our method that's a bit more confidential than Zoom. But I think that almost all clinics across the United States have made this rapid transformation. There had been a requirement by the Center for Medicaid and Medicare or Medicaid Services that if you wanted to do telemedicine with a patient, they had to go to a center that had been approved by Medicare and Medicaid. So prior to the COVID-19 pandemic, we were doing telemedicine, for example, at River Valley Behavioral Health in Owensboro, but the patient had to come into the clinic in Owensboro, sit down in front of a dedicated console, and hook up to one of our clinicians here at the University of Louisville. So CMS, or Center for Medicare and Medicaid Services, put in a waiver very early in the pandemic that people could be treated in-home with remote delivery. So that's what we're doing in our clinics today. And if you need help, you can even call and get a new evaluation done by telemedicine. There's some other things that you might consider that would be helpful during the pandemic if you don't think you need to see a professional, or you maybe are seeing a professional and you want some extra resources. And these are the classic self-help books that have been around a long time. You can get them on Amazon, they'll deliver them right to your door. I wanted to give you just one example of something that I thought is very helpful. I've used it with many of my patients. It's a workbook called Mastering Your Anxiety and Worry. That's Mastering Your Anxiety and Worry. It's a terrific book, step by step, very practical, very helpful, specific skills that you can build in managing anxiety and worry. The authors are Michelle Kraske, Kraske, and David Barlow, Barlow. And if you don't mind, a little bit of a plug here. My book, which I wrote with my daughter, Laura McCrae, Breaking Free from Depression, can help people with depression. And there are also lots of useful apps which you might consider. I don't know if any of you are using these now, but these apps have been tested in some cases and oftentimes been found to be helpful for stress and anxiety. You have to be a little careful when you pick an app out of the blue by going to the internet, because some of them are just constructed by people that aren't clinicians, that don't have the professional expertise to be able to guide the development of the content. And some of them may not be entirely secure, but I do recommend some of these. The Department of Defense has developed some really great apps, high production values, very helpful. A couple of these are Breathe to Relax, that's Breathe to Relax, and the Virtual Hope Box. The Virtual Hope Box. They're free. You can go to the internet and download them. I have them on my mobile phone and use them from time to time and show them to my patients. Another app that you might consider is one that's the top ranked one for mindfulness meditation. My colleague, who's the director of the mindfulness program at Oxford University in England, Willem Kijken, recommends this app highly. It's called Headspace. That's Headspace. And then finally, I'd recommend one that my daughter picks. My daughter, Laura, who I wrote the book with, is the director of the family medicine residency at the University of Vermont and works a lot with patients and with helping professionals who are full of anxiety and stress. She recommends the app called Calm. Calm. It's a popular app and it helps with relaxation and stress management. So these are some of the tools that you might consider using during this time of crisis. Just in wrapping up, I wanted to note that I want to give you a disclosure. I talked a bit about my own book and some computer programs, and I received royalties for my books, and I also have an NIH grant right now for doing research on computer-assisted therapy, and I have an equity interest in companies that supply digital behavioral health programs for use in clinical practice. So with that, I think I'm going to wrap up and suggest that you use the techniques that Amy outlined and some of the ones that I suggested, and develop your own personalized action plan for managing the situation we're in. So I think we're now going to move on to some questions and answers.
Okay, very, very good. Thank you both, Amy and Dr. Wright. Wonderful presentations, a lot of really good information that I think ties together. We have several questions here, so I'm going to go right to that. And this first question is for Dr. Wright, and it's from Jean Wesley Savio. Jean asks, first of all, Dr. Wright, does your practice allow for telemedicine therapy across state lines, for instance, for patients who may be sheltering in another state, and have the new CMS regulations relax those restrictions? And then Jean also asks, where can she find your books? Where can she buy them?
I heard the first question. I couldn't quite hear the second one, but I'll answer the first, and perhaps you could repeat the second.
Mm-hmm.
There is a problem with delivering care to people in other states, and they're what I consider to be somewhat archaic licensing requirements. We're in a digital world, and people all over the world can connect, and we're connected now. People that are living in Indiana, or probably there are some people in Indiana that attend this meeting. So we need to think about how we can overcome these barriers to supplying care. So if someone, for example, from New York State wanted care to our services, there might be an issue with licensure, and unless you're licensed in New York State. My colleague, Robert Pottle, who's director of telemedicine at the University of Louisville, has used the phrase that this COVID-19 crisis has let the genie out of the bottle. That means there were all these constraints on delivering care virtually by internet and across state lines that are going to need to be rethought even after the COVID-19 crisis passes by. But there'd be some opportunities there for getting greater access to care, reducing costs, improving efficiency, and really helping a lot of people that might otherwise not be able to get that kind of help. I have several patients that drive several hours to see me, and they've been eternally grateful for their video calls. They usually have to take a whole day off to drive here to Louisville, park, go into the waiting room, sit and wait for the visit, have the visit, and drive back home. And now they can do it all just by signing on to a Zoom meeting or a Blue Jeans meeting in our case. So I didn't catch the second question. It had something to do about books.
Yeah, Jean's second part of her question was noting that your book Breaking Free from Depression has some great self-help worksheets, and she was asking where can she find, or where can anybody find those books?
They're available on Amazon.com.
Okay.
Yeah.
All right, excellent. This next question is from Ken Grossman, and it's for Amy. And Amy, Ken would like to know, what are your thoughts on the, quote, just eat real food, end quote, or JERF diet and gluten-free diets?
So Just Eat Real Food is an amazing program. Any program that any program that says eat real food, I am going to absolutely endorse. I'm not, full disclosure, I'm not a big fan of keto. And yes, do you get results with keto? Absolutely. But you know, you need those fruits and vegetables. You need some of those carbs for your brain to function. So Just Eat Real Food is great. Gluten-free is fine too. I do gluten-free. It's just because gluten does interact with my system. The thing is that you have to be careful about gluten-free is that it's the same thing back in the 80s when we went fat-free. So then came Snackwells and fat-free salad dressing. It's the same thing with gluten-free. There's a whole gluten-free crackers, chips. It's all the convenience foods. So yes, you can be gluten-free and that's fine. And that's a lot of people help that because they're not eating the pastas or they're not eating the breads like normally they would do in a big quantity. But just be mindful of the fact that gluten-free is not unless you really have celiac disease, you don't have to do gluten-free. But if you're going to do gluten-free, it does not give you license to eat all the gluten-free products.
Okay, fair enough. This next question is from Cynthia Miles Brown, and it's for Dr. Wright. And Wright, Cynthia would like to know, if you would comment on social distancing for children versus adults. And she said that they have found that while technology devices are okay for some of the time, their elementary school age daughter really misses the personal interaction with her playmates and friends, the playing, the hugs, etc. If you could comment on that, please.
Thanks for that question. It's a very important one, and it's hard to answer in a way. We know that kids are much less likely to have troubles if they get infected with COVID-19. My pediatrician friend that I mentioned earlier tells me that when he has kids in his practice they think might have it, he doesn't worry so much about it. But the problem with it is that kids can transmit the virus to other people. So the recommendation are that we all need to maintain this social distance. It's so difficult when you have kids that are used to playing with one another and they're told to stay inside or to social distance. So I'm not sure I have a good answer for this, other than I think that we have to follow the governor's recommendations and the CDC's recommendations as best we can. It's not going to always be perfect. I mean, you tell a 4-year-old, a 5-year-old, they always say 6 feet apart, and it's not going to happen all the time. I'm a cyclist, and I ride around and I try to stay way away from people because I understand if you're moving fast, that the 6 feet may not be enough. It may need to be 20 or 30 feet. But I'm noticing that groups of kids are congregating, they're riding their bikes and they're playing, and I worry a little bit about that. I worry about it because the kids can't do it if they're really following the recommendations. It's not good for them. But also worry about what that's doing to the transmission and maintenance of the virus in the community.
Okay, thank you. This next question is for Amy from Ashley Brower. And Ashley's question is, with the worry about supply chain interruptions for fresh produce and meat later this year, many folks might be considering stocking up on frozen foods. Do you see any drawbacks from eating frozen foods versus fresh? And Ashley, I'm sure that's not from your dog asking about the dog food supply.
Actually, frozen food is just fine. Most frozen food is a flash frozen, so it's taken right from being a fresh produce, and same with meat. A lot of it's flash frozen. Now, once again, you have to be careful if there's any additives added, and you can always check the labels to see what else is added. It's kind of funny that my friends in California are having a huge problem trying to find produce. And every time I go to Costco, Sam's, or Kroger, when I go out for a weekly shopping trip, unfortunately, I have no problem finding produce in Kentucky, which kind of shows you where our diet is in Kentucky. So, but yeah, I am actually looking at filling our freezer up just in case for that reason. But frozen is just fine. Frozen is actually a little bit better than canned. Canned has a lot of sodium content. So, and then you can also do dried. So if you do dried beans and you film in Instapot, that's also an option.
Okay, thank you. This next question is for Dr. Wright, and this is from Alice Bridges. Alice would like to know, what is your opinion of the efficacy of self-havening or soothing touch techniques?
You've asked a question that I'm afraid I'm not very good at answering. I don't know the data on havening. I have patients of mine that are using it and find it to be very helpful. So on an anecdotal level, it sounds like it's useful. I don't know of studies that would claim that it's so-called evidence-based medicine. We do know there's some therapies that certainly are evidence-based for mental diseases, mental illnesses like depression and anxiety, like cognitive behavior therapy, medications, problem-solving therapy, behavioral activation. These are therapies that a clinician can do with a real assurance that it's going to work or has a reasonable chance of working. Havening, I'm not so sure about. Have to investigate that one further.
Okay, very, very good. The next question is from David James, and this is a question for Amy. And Amy, David would like to know, what do you think of Noom? I guess it's in.
Oh, once again, Noom's okay. I don't know much about it, although I have a couple of clients who use it, and it's another tool that is great to use, especially because I think it also does Whole Foods, and it does track your progress. So there's not one thing that fits everybody. It's not a one size fits all. So whatever you can find that works for you, and that it's not a, I want to say fad, that it's, I want to say scientifically proven, but it's whole foods moving, then absolutely.
Okay, and I'd like to tie a question on that's related to diet myself, and that is, from time to time you'll hear people talk about suggesting reducing or cutting out the consumption of sugar-free soft drinks, such as Diet Coke. I'm just curious as to what you think about that. And I, self-disclosure or full disclosure, I like Diet Coke.
Okay. I used to be a Diet Coke junkie. I love my Diet Coke. My problem with Diet Coke is inflammation, is the chemicals that are in it, and plus sucralose. So the NutraSweet, the sucralose is not a very good sugar substitute. You're better off going with something like stevia. And there are studies after studies that have shown that an increase of A1C, an increase in diabetes is associated with drinking soft drinks. A lot of the time, because sometimes you think you drink a soft drink, so it's okay to have it with XYZ. And so it's maybe there may be the correlation of what you drink with the soft drink. But if you can replace the soft drink with other things, like maybe water with, there's water enhancers that if you need that flavor, something called, it's Stur, S-T-U-R. It's a stevia based. So if you need bubbles, just try some carbonation with putting some little bit of flavor in it. But if you can get rid of that Diet Coke habit, one, if you have headaches, they're gonna go away. If you have arthritis, it will probably decrease. So the more you can get rid of Diet Coke, the better.
Okay.
Sorry.
No, that's fine. I'll keep that in mind. Very helpful. Let's see now. I have a question here. Let me page up to it. This is from Alyssa Evans-Turno, our executive director, and it's a question for Dr. Wright. Alyssa would like to know, in doing teletherapy with young children, do you have any tips on how to engage them effectively?
I'm not a child psychiatrist, so I can't claim to know much about this. So I think I'm going to have to pretty much defer on that question. I would think that you'd want to be very attuned to what kids like to do, and to maybe have some gaming kinds of opportunities. In child psychiatry, if you're doing it face-to-face, lots of times you do things with art or with drawings or with other ways of expressing yourself, as opposed to the work you might do with an adult who's coming in for therapy, in which it's almost all verbal, talking with one another. So I'd be thinking of trying to do things really to engage the child, keep the child interested, make it sort of fun in a way, or interesting for the kid to participate in the session.
Okay, we have one last question, and this is from Michelle Oberst, and this is for Amy. And Michelle would like to know if you have any thoughts on intermittent fasting.
I do intermittent fasting. So there are rights and wrong ways to do intermittent fasting. You cannot just have a feeding window. For example, mine's 12 to 8. So you can't just have a feeding window and figure out that you can eat whatever the heck you want. There are right and wrong ways. So do your research, get with somebody who knows what they're doing, not just somebody who might be saying, oh, I do it, and there's a lot of different articles out there on what to do. But once again, if you're doing intermittent fasting, it's all whole food based. It's eating whole foods. It's decreasing the sugar. It's what I call decreasing the crap. So you can, it's all about keeping your blood sugar stable. And I didn't get into that because that's a whole nother talk. But you want to keep your blood sugar stable when you eat real food, and that everything works better. Like Dr. Wright said, you want the thyroid, your respiratory system, your brain, everything starts to work better when you are eating real food and keeping that blood sugar stable. So yes, I do like intermittent fasting. It's not for everybody, but it does work.
Very, very good. Okay, again, I would like to thank both of our presenters, Amy and Dr. Wright. Fantastic presentations, wonderful interaction with the Q&A. We really appreciate it. I know everybody on this video conference appreciates it as well.